Hi, my name is Susan Salvo, and today we're going to talk about foot massage. So let's pretend that I've just finished massaging her. She's face up now, and I'm going to position myself and her for the best position for foot massage. And I'm going to be using the stool for most of this. So I'm going to undrape her leg. Now I want you to notice I'm going to be taking her arm and kind of getting it out of the way, putting it on her abdomen. I'm going to drape her leg up, pull it out to the side. Now notice I pulled from the ankle and the heel and the knee. I put my hand underneath on the knee and my hand over on the ankle and pulled it out to the side. So then what I'm going to do is I'm going to get two pillows. I'm going to take the first pillow and I'm going to put it under her knee. Very nice. And I'm going to take the second pillow and I'm going to put it here. Now you could use one pillow like this if you wanted to, but I like using two. So we're going to do this again.
Thank you for the support.
So that looks pretty good. Now the next thing I'm going to do is I'm going to put my stool at the highest level, and I'm going to see if this is going to be acceptable. Now a lot of this is going to depend on your table height, your stool height, and the height of the pillows. But I like to keep myself relaxed and I like to put pretty close to my face. If my table was too low or my stool was too high, it'd be like this and I'm having a hard time seeing my work. So I like to be a little up close and personal with the foot. So the first thing I'm going to do is I'm going to say hello. I'm going to have my fingers on the ball of the foot and I'm going to be pulling her toes over my thumbs. This fashion. This helps spread open the metatarsal arch, introduce some movement into those joints. In fact, in anatomy, the foot is considered a grasping organ, so we're going to try to introduce a lot of movement back into the foot. And I'm just taking my thumb now and just using kind of a rocking pressure on the ball of the foot along the heel and up and around, just to say hello to everybody. But we forgot the toes. So I'm going to, now if you notice when I'm pressing on the toes, I'm using my brace finger on the other side, so I'm not going and getting nowhere. So holding the foot, I'm using my index finger as a backboard and just saying hello to the toes. Now if you walk around this way, I'm going to be working on the top of the foot, and I'm going to start with some friction, some circular friction on, this is called the dorsum, or the dorsal aspect of the foot. Just doing some circular friction. Then remember, I'm not sliding across the skin, I'm contacting the skin and moving it over the deeper tissues. Now what I'm going to do is I'm going to take my fist and I'm going to push it into the ball of the foot, and this spreads her toes out. I want you to see that, spreading her toes out this way. And then I'm going to take my fingers, I'm going to put them together to kind of create a line, and I'm going to be massaging in between each metatarsal bone, like this. And she's got 4 little tracks with 5 little toes. So again, it's a frictional movement in that I'm taking the tissue with me and not sliding over this. And this is also regarded as a chucking movement, and that her skin kind of tells me how far I can go. If I want to go higher, instead of sliding, I could just lift my fingers up, go higher, and now I'm contacting a totally different area along her metatarsals. Now see that? Okay. Now, when that's done, you can do the same movement. Instead of my fist being on the ball of her foot, I'm going to put my thumbs into the ball of her foot. And I'm taking my fingers and I'm wrapping them around the front. And now I can go outside and then the 2 inside. And I like to go higher up and really introduce some movement into those toes. Make them all happy. And in reflexology, this is the anterior torso. Okay. Then what I'm going to do is I'm going to say hello to the toes again. And you have a pituitary point. If you look at her toe, she kind of has a little pocket of tissue right there. And that's where the pituitary point is. And the direction is going to be at a diagonal. You're not pushing it in forward, you're pushing it in at a diagonal. And again, I'm having to push it against my curved fingers to get it right. Now what I'm going to do, I'm going to move my arm up. I'm going to be covering my face a little bit. Right, to do this right, I'm going to be curved my finger on the front of the toe, and I'm going to press from the top of the toe to its base. Press, press, press. These are the sinus points. And then to get the two lateral aspects of the toe, I'm going to go from here, I'm going to pivot counterclockwise, and that's clockwise, 90 degrees, and go down. Now I'm pressing the sides of her toes. I'm pressing with my curved finger, this joint, and then the tip of my thumb. So once again, you do this 3 times. On the 3rd time, you rotate, and you go down 3 times. And you do that along all of her toes, okay? Then I'm going to do a walking movement. Again, remember, I'm continuing the stabilization with my fingers. I'm doing a walking movement along the ball of her foot. You're going to do this 3 times. And notice the movement in that distal interphalangeal joint. I hope I got that right. Then I'm going to take the area between the ball of the foot and the heel of the foot. Now because she's kind of buried in the pillow, I'm going to lift her up a little bit. And to take the strain off my wrist, I'm going to push my elbow down and lift it up like that, okay? So it's lifted up, and then you're going to work the area between the heel and the ball of the foot on the plantar aspect of her foot. And you can see her little toes are happy. They're waving at you. And I'm getting to the area just below where I was originally. And again, you're going to do this area 3 times. Now when you get to the heel's kind of tough. So there's a couple of things you can do. If you're comfortable using your walking thumb, you certainly can. I tend to use my knuckle. And to do this, I'm pushing in and twisting, pushing in and twisting. And you just kind of make paths along the heel. And you can do the same thing with your thumb. And then I like to come to this area, which is actually my favorite part of the foot to work. Starting at the heel, I'm going to use a walking thumb. And if you notice, I'm going to keep my arm relatively straight. I'm going to be moving her foot with this hand. So I'm going to have to try to sit up a little bit because this is the way I like to do it. I like to get started, and notice I'm lowering her foot rather than moving my hand. You see that? So I'm pretty much isolating, oops, kind of slippery there. I'm isolating the movement in my right arm by gluing it to my side, and I'm lowering her foot with my left. And then I'm going across the area at the base of the toes. These are the eyes and the ears. Do this traveling move where you make this upside down L. Now watch your little toes. Very nice. Very nice. Then we're going to work on the uterus point and the ovarian point, the ovary point. The uterus point is in this aspect, the medial aspect between the ankle and the heel. The ovary point between the heel and the ankle on the lateral aspect of the foot. And then you're going to finish up with some nice desserts. And I really hope you enjoy massaging the feet of your clients. And I hope to see you later.